in my line of work, in my early days in the armed forces, we had many, I guess, people, whenever an accident happened in the armed forces, we had to respond to these accidents. There were people who, were injured, or people who witnessed injuries. And later on, when I left the armed forces and went into the public hospitals, the emergency rooms frequently get patients who have gone through accidents or even assaults. And going into the addiction center, those of you who have worked with people in addictions will know that many people in their early lives in addictions come from families where trauma is almost an everyday occurrence. And even now, as working in the prison service currently, we also see that same profile of people who because of a, I guess, not so ideal upbringing, have gone to offending. Yeah. So I guess my whole career has been meeting people who have gone through a lot of trauma. So this topic is very close to my heart. What I'd like to do this morning over the next 45 minutes or so is to talk about various aspects of psychological trauma. What are the symptoms of trauma in the near term and in the long term, how it affects people, and what are some of the available treatment methods either with a psychologist or at the hospital, and what are some useful first steps for if any one of you are providing services in the community. Treating trauma requires some degree of training. The reason is because the traumatized person is typically quite distressed, and we really don't wish to re-traumatize people in therapy. So it requires some degree of training to be able to understand the treatment aspects. So I'd just like to share with you some useful first steps if you are a mental health provider out there in the community, because certainly Singapore is not a trauma-free society. We do have relatively low levels of violence, but in the next few slides, you'll see we are still, it still exists in our community, and definitely in our homes, because domestic violence is, there are quite a few families out there, and we see them at the hospital practically every day. So what are the forms of trauma frequently seen in Singapore? We do have physical and sexual assault. I think probably Saturday night there would have been a few cases, typically after drinks or after a corporate function, when people get drunk, things do happen. Actually, we found in our own review that actually during the last 2 years, I think the number of cases of serious violence coming to the hospital actually dropped. And I start speculating is because probably because pubs have to close at 10:30 and people have to stay home, so there are less opportunities for people to come across each other in a drunken state. And that's why I guess there's less violence overall. Domestic violence does occur in Singapore, and typically it's not one-off violence, it's a recurrent violence. It's very hard to get the perpetrators to change their behavior, and we need a lot of time and a whole team of people, including social workers and psychologists, to be able to, I guess, mitigate that violence either through personal protection orders or through other means, separating the couple, especially when there are children involved. Road traffic accidents, industrial accidents does occur, as well as new, I guess, forms of trauma that's more subtle. Bullying, either face-to-face or cyberbullying. Cyberbullying is quite, does happen, especially in primary school and secondary school. At the workplace for adults, there is some degree sometimes of workplace bullying. And of course, people can be traumatized by emotionally abusive relationships. Fortunately, and that was something I was grateful for just now in the mindfulness practice, is that Singapore, we don't see the natural disasters as much. For us, the disaster is when the Wi-Fi goes down, but other places, they have to deal with earthquakes and hurricanes and cyclones. Of course, war does happen even in our region, as well as things like human trafficking. So hopefully you can watch my video. So things like this does happen, right? I mean, when people are not careful. Yeah, this is a video of someone being assaulted at Iron Orchard. Yeah, yeah. So sometimes we do have unruly Singaporeans. And you wonder why it has to become so bad, right? Yeah, over what? Yeah. So this is a reenactment from the CND education video. Yeah. So these are the things that do happen in Singapore, and just because it doesn't happen to us doesn't mean it's not happening at some place at any one time. So what are the effects of trauma? There's actually a spectrum of symptoms that can occur. It's not no one person will have all the symptoms. Not everyone's experience will be the same. So trauma will affect people differently depending on their past history, whether they've been traumatized before, and their own personal resilience and the support that they are given. So in the initial days after a traumatic event like a road traffic accident or even an assault, uh, most people will suffer a few weeks of anxiety, insomnia, uncertainty, anger, and the vast majority of people actually will recover spontaneously, even without any intervention. After 4 to 6 weeks from the traumatic event, most people will spontaneously recover because our brains are able to process the trauma, and especially in Singapore, we have such busy lives that I guess we get distracted and we move on with our busy lives and forget about those incidents unless it has been very, very significant to us. Some people get a more severe form called a acute stress disorder immediately following a trauma. Technically, from a psychiatrist diagnostic perspective, acute stress disorder doesn't last more than 30 days. If it goes more than 30 days, we call it post-traumatic stress disorder. So what the person suffers would be intrusive symptoms such as recurrent nightmares, flashbacks of the incident, even when they're awake. They could be walking on the street or just having breakfast, and the traumatic event replays in their mind. And this is associated with a lot of anxiety because it's terrible to re-experience that trauma. Naturally, the person would want to avoid anything that reminds them of the trauma, the place where it occurred, anything that reminds them or triggers the memory. It could be a smell, it could be a picture, it could be the clothing. Some of these things will replay in their minds. I've treated many taxi drivers who got into an accident, and they find it very distressing to go past that particular junction where the accident occurred. But it's very difficult for taxi drivers because you really do not know your routes, where your route will take you on any given one day, right? So sometimes what we try to do with them is that we encourage them to drive through the junction 20, 30 times, just to get used to that junction again, because this natural avoidance reflex is to protect ourselves psychologically. Many people will feel very keyed up aroused after a traumatic event. They will have sleep problems. They'll be more edgy, irritable, and because their minds are kind of like absorbed thinking, or either trying to not think about the trauma, but their minds want to think about the trauma and then not think about trauma. Many times a lot of mental energy is put towards this activity, even though they don't wish to, and eventually they find it difficult to concentrate on their work or their relationships. And in general, when they are so anxious, there's a lot of negative mood, because they are just wondering why am I like that? Why is it happening to me? So when these symptoms go on for over 30 days, then the label that we apply is called post-traumatic stress disorder. Don't ask me why it's like that. It's just the way the book is written. Same symptoms, less than 30 days, we call it acute stress disorder. More than 30 days, post-traumatic disorder. It's more or less the same syndrome, but it's just given a different diagnostic label. There are other variants of PTSD, and we call this partial PTSD because they don't have all the symptoms, but they have a few of the symptoms. And by and large, sometimes they're distressed by it, sometimes they're able to cope with it. So it's not the full-blown syndrome. So we call that a partial PTSD. And the one that is, I guess for us working in this area, we do recognize, but the textbooks, not every textbook recognizes this syndrome, is this syndrome of what we call complex post-traumatic stress disorder. And this is a syndrome that arises due to recurrent trauma in childhood, all the way to when someone is developing into teenage and into adulthood. It's not for most of the cases that we treat is what we call single episode trauma, a road traffic accident, one assault. But when it comes to complex PTSD, the typical event recurs throughout their childhood. It could be recurrent childhood physical abuse, recurrent sexual abuse because it's an intrafamilial, someone within the family. Or for some people, it could be various forms of sexual assaults, depending on, some people work in certain professions that I guess it does happen to some of them. And of course, for some people, not so much in Singapore, is this issue of human trafficking. Most of us have seen what's happening in Afghanistan in the last week. Some of the pictures that are shown, you can see how, I guess, the conditions for which people are trying to escape and the ways they escape it's not exactly a very pleasant experience. So many people, if they have recurrent episodes of trauma as they are growing up, they get a syndrome called complex PTSD. And typically, the syndrome of complex PTSD, people are either very irritable, they can't focus, they may have difficulty with stress, they don't tolerate stress very well, they are not the most trusting people, they kind of have this great distrust of society because of their recurrent trauma. They, depending on what type of trauma, especially those who have gone through sexual assaults within the family, they may have difficulty in relationships or sexual relationships. And some people, they may be very intense in their emotions when it comes to a relationship because fundamentally they are lonely, but they can't, they find it difficult to sustain a relationship. And then at the start of relationship, it's very, very intense. And then it's kind of like sometimes puts off the other partner and then the relationship breaks down. So actually there are many, I guess, difficulties with complex PTSD because they had gone through a very, very difficult childhood. And now as adults, they have difficulty in relating to others. So what are some of the psychiatric issues that can arise due to psychological trauma if it's not treated? The most common thing that occurs is major depression. The reason is because some people, if their work depends on their particular, like a taxi driver, if because of the trauma they can't drive, then they may feel depressed because they need their income. And they're wondering, why is it that I have this anxiety when I'm driving? It's fairly safe. I drive slowly, but yet I'm still anxious. I got people who were involved in a road traffic accident near their homes, and they have no choice but to pass that particular junction on their way to work and back, and they feel so edgy as they are driving out their homes towards their workplace, and they do it every day. There's no choice. It's the way that I mean, take for example Yishun town. It's very hard to get out of Yishun town to go into the city. You just have to go through Lentor area. So when that I mentioned Yishun because I used to work in Puat Hospital. So my stories come from Yishun area. So there's just one road leading out of Yishun into the city, and you have to pass through Lentor. So some people have accidents around there. They find, I have no choice but to go on this road, and I have to face this every day, every working day. And after a while, they get depressed. Certainly, some people can go into extreme anxiety because by nature, trauma provokes a lot of anxiety. And in order to cope with all these low moods and depression, many of them would turn towards smoking or alcohol in order to cope. And eventually, some people will fall into an addiction. Overseas, where drugs are, I guess, easier to procure, they may get all the hard drugs, cocaine and marijuana and all that stuff. But at least in Singapore, predominantly it's still smoking and alcohol. When the trauma is recurrent and long-lasting, it eventually leads to personality impact. So some people would be very distrusting, as they find it hard to trust society, especially if, let's say, a person was assaulted and then robbed, or someone has been sexually assaulted and things like that. They find that they find the society may be unsafe, and it's very hard to change their view of that because it happened to them. They have to slowly relearn that it's not as unsafe. You have to relearn that to go out again and relate to people again. But then that's why treatment is important, or at least learning about trauma, how it affects you, is important. Some people, they get so fed up with their symptoms and their disability, they harm themselves, self-cutting and things like that. Overseas, when people come back from war, people do experience lots of trauma when they are in the war zone. When they come back, they find that people can't understand them, why they're feeling this way. So they find that they have to relate to other war veterans because people who have not gone to a war zone will never understand how they felt. Some people will end up in unwanted pregnancies or failed relationships because they have difficulty relating to people. Sometimes there's this intensity, impulsivity when they have a new relationship. And some of them would, of course, given all these symptoms, they will have difficulties at the workplace or at school. Because it's not just the work aspect. It's in our workplace before the COVID, we had to be in office with other people. We had to relate to our colleagues, relate to our supervisors, or even our subordinates. So when people have difficulty in relationships, they can't do well at the workplace. Some people eventually will have problems with crime, but not so many. But what's interesting is that for people, especially with complex PTSD and coming from abusive households, what studies have shown is that because they have to cope with their own personal anxiety and their moods and their difficulties, many of them will turn to smoking and alcohol abuse. They don't take care of themselves. They don't exercise, and they like to eat fatty, high carbohydrate, high in oil, and high salt foods because these are very comforting. And eventually they have obesity. And what studies have shown is that people who have been have recurrent traumas in their life, their lifespans can be reduced by up to 20, 30 years compared to a person that was not traumatized. And it's not due to the trauma itself, it's actually due to their lifestyles in order to cope with their trauma. The food that they eat, the non-exercise, and their smoking and alcohol. Those are the things that actually contribute to their reduced lifespan.
My parents don't understand. All the drinking and fighting means I'm scared. I'd like a cuddle, perhaps a bedtime story, but mostly I'd like them to stop shouting at me. And sometimes they hit me. Feeling scared every day and not feeling loved or wanted will change me for the rest of my life. Later, I'll have problems at school, problems with alcohol, and I'll get in trouble with the police. What's happening to me right now means I'm more likely to have serious health problems in middle age and die sooner than I should. Doctors say my life is full of adverse childhood experiences, or ACEs. But in my world, this means I see my dad hitting my mum. Dad's got a drinking problem, and mum's always crying, even with the tablets. I'm always being shouted at and hit. After the booze and fags, there's not a lot of money for toys or clothes, or even food. I'm getting used to being scared all the time. Now I'm just angry. Doctors say things are changing inside me. My brain isn't learning how to control my feelings properly. My body can't relax like those kids who don't have ACEs, so my body won't be able to repair itself properly when I get older, making it more likely I'll get cancer or heart disease as an adult. It hurts when my parents hit me, but the real damage is hidden, and that damage will be with me for life.
I drink and smoke. They say I'm out of control, but I'm not. It's just my way of coping with my ACEs. I've been in plenty of fights, but what's wrong with that? Kids' punches don't hurt half as much as when my dad hits me. I beat up a kid last week at school because he looked at me weird. Who cares? I ended up with more time out of school. Learning's not for me anyway, and the teachers don't care any more than my parents. I don't like the way anyone looks at me except my girl. She's 16 and pregnant, just like my mum was with me.
So this is where I've ended up. I've got diabetes and cancer's probably on the way. I know these kill you, but I couldn't do without them. I've never had a proper job and I've spent time inside. I hate my kids. I hate their mum too, until she left, so my kids have grown up with ACEs. And now my daughter had her first kid. She's 16. The course of my life was set in the wrong direction a long time ago. I know where I'm heading, and sadly I know where my kids are heading too. This doesn't have to happen. A little help in childhood makes a big difference to where life takes you. When I was a baby, the nurses noticed that my mum wasn't coping and helped her and explained how important my childhood is to the rest of my life. So, with a bit of help, she coped. The police came round after next door complained about the noise from mum and dad fighting. They asked how I was feeling. I told them I was scared all the time. Mum and dad got help. The shouting got better and the hitting stopped. I even got some bedtime stories. I still had problems at school, but the teacher asked me about what was happening at home. I got help controlling my feelings. It wasn't a lot, but it was enough. I'm now married with 2 children and I've got a job most of the time. I haven't repeated the same problems with my kids. We got help when being a parent got too much. Our children are ACE-free, and that means their kids stand a good chance of growing up ACE-free as well. Almost half the people in England and Wales experienced one ACE as a child, and 1 in 10 of us suffered 4 or more ACEs. If we stop ACEs, millions of children would not become smokers or binge drinkers, and levels of violence in adults would be cut in half. Fewer ACEs in childhood also means fewer adults developing diseases like cancer, heart disease, and diabetes in middle age. We all need to be ACE aware. Are you? Doctors, police, nurses, teachers, firefighters, and most importantly, parents. The more you know about ACEs, the more you can help stop children growing up with ACEs in their lives.
So why is it that ACEs is so toxic to the growing child? The reason is because as a child is growing, just as they are becoming taller, they're becoming heavier, the brain itself is also growing. So the brain needs to connect. The brain is made of billions and billions of nerve endings, and they need to connect in a way that is normal. So what they find is that when a person is constantly traumatized, re-traumatized, the person has a lot of stress hormones running around their bodies. And this leads eventually to the brain not being wired up in an optimal way. And that's why you see in the video, when ACEs are present, it tends to be a very long chronic problem for the person. They find it very hard to undo that trauma. And the best way to approach it is prevention, not so much treatment, but the best way is to give them a good enough environment for them to grow up. Because once the brain is wired in a, I guess, not so optimal way, then they have a lot of difficulties. They will have difficulties concentrating, focusing, at not just at work, but earlier on in school. They tend to be very suspicious or see things in a very threatening way. The reason is because they've always been threatened at home. You see. So they may perceive strangers or even colleagues in a very threatening way, and they're very distrusting people. So this is due to the way their brain was shaped as they grew up 15, 20 years in a household that is full of abuse. Resulting from this abnormal brain wiring, you see that these people emotionally, they're not so stable. They tend to be impulsive. They tend to be pleasure seeking because their lives are so difficult to deal with. So they may go for thrills, try drugs, try substances, alcohol, smoking, have sex, and or do things that are risky for the thrill. Eventually, some of them will develop some form of mental illness that I mentioned earlier. And they generally have low self-esteem because they typically are not so achieved compared to their peers. As I mentioned, they do turn to drugs and alcohol to cope. And then they have less success in life and a lot of difficulties in relationships. Some of these people find themselves in abusive relationships. So what you find is that some people, it's like a matchmake. It's really a matchmake in hell. There will be some people who are the perpetrators of abuse, and these people know how to find a partner that they perceive to be not so, I guess, have low self-esteem, and they find people who are more easy to bully, and they pair up together, and then becomes this matchmake in hell. But this is the situation that we see, that some people find themselves when you have a past history of trauma, you find yourself in a emotionally abusive relationship again. And as you saw in that cartoon video, ACEs have this way of being able to transmit from one generation to the next generation if it's not stopped. So abusive parent will abuse their kids, and then the kids eventually through the ACEs will become perpetrators themselves when they become parents. And some of these people become parents very young in life, I used to work in the armed forces, and I used to meet all these teenagers, late teenagers, 18, 19 years old. And when they enter into NS, they are already fathers. Yeah, so and because of that, it's very difficult, isn't it, to do NS, and then you have to you're already a father at that age. Yeah. And eventually they will suffer from health problems because of the substances that they use and the lack of exercise. So what are some of the treatment approaches? What you see on the screen here, typically we would use for what we call single episode trauma. That means a single road traffic accident, a single assault. The interventions here are not so much geared towards the complex PTSD, because that one is really fairly difficult to treat, and those are more, the approaches are more psychological than medications. So the first thing that we teach all people with trauma is how to calm yourself. And MBCT, mindfulness practice, is really an excellent intervention for people to learn to calm themselves, because it's available to them. If they master it, they are willing to learn it, they are able to calm themselves down without having to resort to medications or alcohol or drugs or smoking. So there are specific interventions that are focused on trauma, but typically what we try to do, especially if it's a single episode trauma and the person comes from a very supportive family, what we try to do, if they are able to cope with it, is that we tend to want to re-expose them to the trauma in small bits until they get used to the trauma. So the idea is that we want them to experience that traumatic event again and again in small doses, so that their brain eventually get used to it. Like many of us, right, we have a favorite movie that we love to watch, but we can't watch a movie like 20 times, right? We eventually get sick of the movie. So that's the same thing we want to do. If someone's afraid of a particular accident, for example, we want to walk through that accident with them, either through talking about it, through thinking about it, imagining it, or even journaling, writing about it. So when people process that thought over and over again, eventually many of them would actually get better, because the mind has processed that information. For people with more difficult, more impactful trauma, there's an intervention called eye movement desensitizing reprocessing, EMDR. This is a very effective way of treating trauma, but unfortunately, not many people are trained in this area. There are people who are trained in this area, but not many. So some of us working in the hospitals are trained, but out there in the community, not everyone is trained. So it's although effective, it's not widely available. From a psychiatrist perspective, we do prescribe medicines to treat the symptoms associated with trauma. So this could be, for some people, especially in the 1 month after the trauma, people have a lot of insomnia, nightmares and all that. We do give them short-term sleep medications so that they can sleep, have a good night's sleep, and carry on with their work the next day. Some people get depressed, and we do provide them antidepressants as well as medicines to reduce their anxiety. However, these medicines are what I call symptomatic treatment. They're not particularly effective against the trauma itself. What cures single episode trauma is really re-exposing yourself, processing that trauma in your mind until you're used to it and are not afraid of it anymore. So last time they used to say, when you fall off a bike, you get back onto the bike again and continue to cycle. My kid also, while learning cycling, he crashed at the park. He was very afraid, and I just made him, try again, and now he's cycling. So it's the same principle for single episode trauma. But when it comes to complex PTSD, it is a different approach. Complex PTSD is about helping a person understand himself, understand why he's reacting in a certain way, and helping him to learn about himself and how to make good choices. Good choices meaning to say how to manage your relationships. Don't choose a particular type of partner that is abusive, or be more careful about the how you cope with your anxiety. Watch your thrill seeking, watch your sexual activity, things like that, and help them to relate, more normally to others. So it's a lot of it has to do with a very, I guess, prolonged coaching and conversation with them over many months or even many years. I mean, you can't expect to undo 20 years of trauma in 1 week of therapy or things like that. So it's about, I guess, journeying with them through their ups and downs in order to help them learn about their own reaction to situations because resulting from that traumatic experience. But of course, the mainstay, as you saw in the cartoon video, is about prevention. If you know of someone who has a neighbor, if you hear screaming at home recurrently and things like that, I think it's not. I think actually right now they're encouraging people to report if you know of abuse in a neighbor's house. Just call the police. Yeah, or even you can call the child protection hotline. You can just Google Child Protection Service under Ministry of Social and Family Development, because in doing so, you're protecting this child from further abuse, especially as you can see the ACEs. Once this thing is recurrent and the person is exposed to it every day, it has a very long-term effects on the child. So what do we do with some of our clients or patients? We spend a lot of time teaching them about trauma. What are some of the symptoms they experience and why they're experiencing it. Then we also teach them about the impact of trauma in the other aspects of their lives, their relationships, their work, how to take care of yourself, their health. We teach them a calming technique because you never know when a trigger can happen. So they need to understand how to calm themselves down and to practice this calming technique. We advise them to really watch their drinking and smoking, and then how to draw boundaries in abusive relationships, or how to, I guess, either get help or even exit an abusive relationship. I once had a patient whom had a very abusive husband, and she was subject to recurrent domestic violence, and it was a journey of 7 years until she decided that to end the relationship and bring the children out of the house. And eventually, it was really 7 years of journeying with them before she had the courage or felt ready to leave the relationship. The reasons were because the kids at that time were young. She was a homemaker, so she didn't feel she had the financial ability. But some of the things we encouraged her to do was to, because she was a graduate herself, she had a professional license in one of the professions. We actually spoke about it, and eventually, in preparation to leave the relationship, she actually went out to work again, and so that she could sustain her kids and herself. And once she was steady in a job, then she started the divorce proceedings. Yeah. We also tell them that contrary to what people they would like, some people are traumatized, especially when they're young. They like to thrills, and they like to be stimulated. So we tell them that the opposite is helpful. The opposite is to have a lifestyle that's routine. Try to minimize crisis and drama in your life because you already have enough of that. So you want something that environment at home that is calm and safe and predictable. So we also tell them that it's important to get a job and stay in a job, because one of the things that are very high, I guess, anxiety provoking even for all of us is that we don't have enough money, right? If you were to, I think if I brought up the idea about retirement spending and how much money you need to retire in Singapore, you switch off this Zoom now and probably get into a panic mode. Yeah. And we also tell them maybe you need to have short-term goals, because it's not helpful to have these very grand big plans, because many of them can't achieve short-term goals. So we just try to focus on short-term goals. And as I mentioned before, for some people, it's like a journey of many years before they actually execute that plan to exit a relationship or make a big change in their lives. So we try to go for short-term goals with them. So this is kind of like the things that we do as part of our work with people who are traumatized. And this is what I just mentioned is more geared towards the people with complex PTSD, whereas the ones that I showed the slide before where we do the EMDR or the cognitive therapy, those are more for the single episode type of trauma. So if you are a mental health provider in the community, because all of us actually would meet people who have been traumatized. It's just that you're either unaware of it or they don't tell you. Even in our normal lives, all of us are traumatized in small bits and pieces everywhere. I don't know about you, but when that River Valley incident occurred, I couldn't sleep at night. Yeah, because it was just so horrific. Yeah, even I'm nothing to do with that case, but just reading about it was quite horrific for me. Even though in my work I see so much trauma, some of these things are still impact you very deeply, and you don't know why. Yeah, you don't know why. So as a mental health provider in a community, you need to be able to, I guess, understand how trauma affects a person, and not so much that you intervene in one of those specialized interventions for trauma, but it's more like educating your client about how to cope with the anxiety, what trauma does to them. Because I say that you really need training in order to deal with traumatized clients. Because if you don't do your therapy well, you actually re-traumatize them and worsen their situation. Yeah. We also need to, I think it's important to educate them on where to find help, and when to go to see a psychologist, when to see a psychiatrist, where to find help in the community, and point them to what I call educational materials. And there's lots of free materials on the internet on trauma. Like you can go to YouTube, you can go to the National Library to borrow free e-books. It's more about learning about the situation, about trauma, that is very helpful to them. So it's not necessary for those low-level trauma and things like that. You don't really have to come see a psychiatrist if you are still coping in your work and your relationships. Sometimes self-help is very important for self-healing. It can happen when it's not too traumatic. Yeah, and of course, teaching them that calming method. In Brahm's case, it would be mindfulness-based interventions. But these are the things that are very useful for them to calm themselves down, because there's a lot of anxiety associated with trauma.